What is wound dehiscence and why does it happen? Have you ever wondered what happens when a wound that was supposed to heal suddenly reopens? This condition is known as wound dehiscence. It can be concerning, especially in survival situations where medical help may not be readily available. So, what exactly is wound dehiscence and why does it happen? Wound dehiscence occurs when a surgical incision or wound that was previously closed pulls apart or reopens. This can happen partially, where only some edges separate, or completely, where the entire wound opens through all layers of skin and sometimes muscle. Typically, this happens within the first week to 10 days after surgery, during the early stages of healing. The main reason wound dehiscence occurs is that the wound fails to heal properly. Healing usually goes through 3 phases. First is the inflammatory phase, where the body sends cells and fluids to clean and protect the wound. Next is the proliferative phase, where new tissue forms and pulls the wound edges together. Finally, there is the maturation phase, where the new tissue strengthens. If anything disrupts these phases, the wound may open again. Several factors can contribute to wound dehiscence. The most common cause is infection. When bacteria enter through the incision, they can delay healing and cause the wound to break down. Increased pressure on the wound area, such as from severe coughing, vomiting, or straining, can also physically pull the wound apart. Certain medical conditions can slow healing and increase the risk of dehiscence. These include diabetes, obesity, malnutrition, and smoking. Physical trauma or movement that stresses the wound before it is fully healed can also lead to this issue. Additionally, the surgical technique and the quality of wound closure play a role in the risk of dehiscence. Understanding wound dehiscence is essential in survival situations. In the wilderness or during emergencies, surgical care is limited, and wounds may be at a higher risk of reopening due to infection, movement, or poor nutrition. Proper wound care is vital. This includes keeping the wound clean, avoiding unnecessary strain on the area, and monitoring for signs of infection, such as redness, swelling, pain, bleeding, or discharge. If dehiscence occurs, it can lead to serious complications. These include infections spreading deeper into the body or, in severe cases, organs protruding through the wound, which is known as evisceration. This situation requires urgent medical attention. To prevent wound dehiscence, apply appropriate wound closure techniques when possible. This can include sutures, staples, or adhesive strips. Maintaining hygiene is crucial to reduce infection risk. Avoid excessive movement or pressure on the wound site, and monitor the wound closely for early signs of reopening. If you notice any signs of dehiscence, seek medical help as soon as possible. Recognizing wound dehiscence early and managing it properly can help prevent complications and support better healing outcomes, whether in controlled medical environments or survival situations.